Welcome to Excessive Absenteeism with Emily Arrington, Mackenzie Moore, Olivia Scalf, Anna Schuff, and Leah Spangler. In today's video, we will be discussing absenteeism. Absenteeism is a habitual pattern of absence from work. Dissatisfaction with one's job, workplace bullying, sickness, parenting responsibilities, nursing burnout, scheduling, occupational injury and illness are all factors that contribute to absenteeism. Now let's listen to Nurse Manager Donna explain the impact of absenteeism on the nursing practice.
Nurses and their attendants' behavior can seriously affect quality of care outcomes such as rate of medical errors in addition to financial cost. The financial costs associated with absenteeism, if uncontrolled, can put the financial health of the organization into jeopardy. If employee attendance is managed and managed well, it says a lot about your organization. It says the organization cares about its human resources and wants to fulfill its promises to its clients. Managing attendance is a commitment to doing a good job. Managing attendance promotes employee confidence in management, contributes to positive employee morale, helps to deliver services and products efficiently, and contributes to the organization's financial health.
Meet Sylvia, a novice nurse with 2 years' experience on this med-surg unit. Sylvia is being bullied by 2 co-workers. They often criticize her nursing practices, claiming that she thinks she's better than everyone because she went to Radford University. They also will ignore her when she asks for their help, and she's overheard them gossiping about her throughout her shifts. Sylvia has tried to address the problem on her own with her co-workers, but they just blow her off. It has gotten to the point where Sylvia feels so defeated and anxious about going to work that she has been calling off from work multiple times during the scheduling period. The nurse manager meets with Sylvia to discuss the absenteeism. When she learns that Sylvia is being bullied, she promises to address the issue. The nurse manager meets with Sylvia and her co-workers individually to address the problem. She then holds a meeting where they can all talk through their issues together with a mediator. The nurse manager also decides to hold an annual workplace bullying in-service for all employees. Meet Alex, an experienced nurse of 15 years who is experiencing compassion fatigue and caregiver burnout. Due to her caring and compassionate heart, Alex is often given the most difficult and sick patients during her shifts. Alex is also a mother of 3 and is acting as a part-time caregiver on her off days for her mother-in-law who has Alzheimer's. Her mother-in-law's health is declining and Alex is shutting down. During her 15 years on the unit, Alex has rarely ever called out. However, due to the stress she's been facing, she's been calling out more frequently. The nurse manager meets with Alex to discuss the absenteeism. The manager knew Alex had a lot going on, but was unaware of the toll it was taking on her mentally, emotionally, and physically. The two come up with a plan for Alex. They discuss the possibility of Alex stepping down to part-time during this phase in her life to ensure she can focus on herself and her family. The nurse manager also advises Alex to seek services from the hospital's employee assistance program for further resources and guidance. Meet Eleanor, an older nurse with over 30 years of experience. After years of not practicing proper body mechanics when moving patients, Eleanor suffers a back injury at work. It turns out Eleanor has a slip disc. The pain and discomfort from the injury forces Eleanor to frequently call out of work. The nurse manager meets with Eleanor to discuss her absenteeism. They review her doctor's note that encourages Eleanor to attend physical therapy for a month. Following the recommendation of her doctor, Eleanor and the nurse manager decide for her to resume work starting on light duty in a week. She can then progress back up to her normal workload as she progresses through physical therapy. The nurse manager also decides it's important to hold quarterly body mechanics in services for staff to avoid further injuries like Eleanor's. Thank you for watching today's video. Remember, absenteeism of personnel often influences the subsequent work environment by increasing the pressure of the staff left behind. Employees watch how managers deal with workers who do not attend work regularly. If they think management does not care or cannot deal with poor employee attendance, their attitudes towards work decline. Nurse managers that consider absenteeism in the context of organizational, job, and interprofessional levels could have a more accurate representation of their nurses' pressures and decisions to attend work.